As a psychiatrist, I know I get carried away when I say it, but I think not having an MTHFR test for a psychiatric patient is malpractice because the results can be dramatic. It can change the course of an illness or it can augment the effects of a medication.
How do you use ashwagandha for anxiety, and is there something behind the adaptogenic quality?
A 2 to 4 week trial for some can be dramatic, and it's certainly better and safer than some of the anti-anxiety medications that we as a psychiatrist would typically run to.
What role does diet and nutrient deficiencies and toxins play in ADHD symptoms?
Untreated ADHD has consequences. The biggest one is
Hello and welcome back to another episode of the Vibrant Wellness Podcast. I'm Dr. Emmie Brown here with Melissa Gentile. Today we are thrilled to introduce a luminary in the world of integrative psychiatry, Dr. James Greenblatt. Dr. Greenblatt brings over 3 decades of experience in personalized medicine for mental health. And as a pioneer in the field, he's not only served as the Chief Medical Officer at Walden Behavioral Care, but is also Assistant Clinical Professor of Psychiatry at both Tufts University and Dartmouth College. Dr. Greenblatt's work spans numerous books and international lectures, focusing on the crucial role of nutritional interventions in mental health. Get ready to be enlightened by his groundbreaking functional medicine approaches to psychiatry that emphasize healing from within. Dr. Greenblatt, thank you so much for joining us today.
Thank you, Emmie and Melissa. Very glad to be part of this podcast, educating our colleagues.
Yes, we're happy to be here. Okay, so before we jump into nutrition and mental health, I'd love to know, Dr. Greenblatt, was there a personal experience or series of events that inspired you to take a more holistic approach to mental health? How did you get to where you are today?
Well, I just early on, I think due to my mother's influence, reading books on nutrition, I went to college interested in the relationship between nutrition and brain function. So I did papers on vitamin B3 and schizophrenia. I won't even tell you what year that was because you probably neither were born. So I had that interest even before medical school. And as a traditional, medical doctor, I started off medical school teaching yoga and holistic health to the medical students. And then, 9 years later, I came out pretty unhealthy and a psychopharmacologist just prescribing prescriptions to individuals. And very quickly, I realized that wasn't what I was interested in doing. And back to the reason I went into medicine. So early on in my career as a child psychiatrist, I just started looking at nutritional, metabolic, and environmental factors that affected kids with ADHD and autism is how I started. And that's been my 30-year journey.
So you were teaching yoga in your program, you were just saying?
When I went to medical school, I was, doing the brown rice and kale before it was popular.
You were ahead of the curve.
I love it.
We had a yoga program. We actually taught the other students, and it was, a great first year. And then after that, you got sucked into the world of medicine and training and just lost those both lifestyle and coping skills.
But you found your way back.
Yeah, very quickly, and fortunate to be able to, as a child psychiatrist, and then a large chunk of my career, 25 years, was in the eating disorder world, where I got to keep one foot in traditional psychiatry because nobody could argue with me when I gave lectures on omega-3 deficiencies and zinc deficiency with our patients with anorexia. Now, my colleagues didn't agree that that was a problem, but they really couldn't argue that it was something to explore. So I was able to stay in a traditional psychiatric world, talking about nutritional psychiatry, using the eating disorder community as a kind of path towards that model.
So you were really able to kind of enlighten them a little bit, kind of bringing these other nutritional concepts into the traditional side of treating eating disorders.
Enlighten was the goal. I think over the years, I think our traditional colleagues from our academic institutions have been able to embrace nutrition and metabolic psychiatry, from ketogenic diets to mindfulness to nutrition. I would have to say the eating disorder community has been the slowest to come around. to the need for nutritional support, even though it is the most life-threatening illness we have in psychiatry and the most limited models we have with our traditional treatment.
I definitely want to pull on this a little bit deeper throughout the interview today. But before we get really deep into nutrition and psychiatry and that connection there, I do want to touch a little bit on the gut-brain axis. And before we even get into like microbes and mechanisms and all the nitty-gritty around the microbiome, how are the gut and brain connected physiologically? And how do they influence each other? And is it bidirectional?
It's absolutely bidirectional. We think of if we're getting nervous and we get nervous, stomach and get nauseous or throw up, but it's just as powerful going the other way. And it starts, everywhere along the GI tract. And the good news for us in the integrative and functional world is the research is exploding. So it is traditional medical colleagues, mental health colleagues, integrative colleagues are all exploring this gut-brain connection. It is real. It is powerful. We discuss the second brain. We have more nervous tissue in our GI tract than anywhere else in the body. There's neurotransmitters that are produced in the GI tract. And the list is endless about how foods affect the microbiome and how microbiome products can affect brain function, from its food sensitivities to actually byproducts of some of the bacteria affecting brain function.
So how does the gut microbiome influence mental health in that way? You just mentioned neurotransmitter production.
Yeah, I mean, it's not that the neurotransmitters in the gut are not the same that's in the brain. So I think there's some confusion there. And, these neurotransmitters are produced in milliseconds and disappear. But it's just the fact that it's the same nervous tissue, but through nerves, mostly the vagus nerve, this gets communicated, back to the brain. And it's just a critically important part of our kind of mental health. We can think of it in many ways, and it would be very complicated to go into details. But I think the question is, it absolutely affects mental health. It has to be addressed by clinicians. We have to listen to our patients, who are struggling with both kind of GI distress symptoms as well as mental health symptoms, not and acknowledging the connection.
So it sounds like the neurotransmitters that are produced in the gut, they send a signal up to the brain through the vagus nerve. I had this idea that they somehow, neurotransmitters themselves made it up there, but it sounds like they're kind of separate entities here.
Yeah, I mean, we would like to think so. And I think there are many physicians who still practice that way, but I think it's one close to impossible. But it's actually, it's affect the integrity of the gut. It would affect the gut wall, food sensitivities, a whole host of other motility in the gut, the microbiome in the gut, that are all sending communication messages to the brain in different ways.
And I want to segue into anxiety for a moment, Dr. Greenblatt. I read you have 3 favorite supplements for anxiety, and I want to start with the nutritional aspect here, or the nutrients in particular, magnesium and vitamin B3. And then we have an herb, ashwagandha, which has become increasingly popular. Really, the popular culture is jumping all over ashwagandha. And so let's start with the nutrients, magnesium and vitamin B3. How do those work to decrease anxiety?
Sure. I think one of the simplest aspects of nutritional psychiatry that everyone on the planet should be aware of, and it seems like everyone on TikTok is magnesium. I mean, I think that is the most common deficiency that we see in mental health practices, cutting across every diagnosis: ADHD, depression, and anxiety. But anxiety is the most responsive to supplementation. The other symptoms of magnesium deficiency that are important would be things like constipation and insomnia. So if you have someone with anxiety, constipation, insomnia, providing magnesium will most likely help the constipation quickly, the insomnia next, and the anxiety should improve, within 2 to 4 weeks. There's not a lot of great testing, for magnesium deficiency, because most of it's in our bones and cells. So I think it's completely safe for any patients to learn and start magnesium supplements if anxiety is one of the symptoms.
And what form of magnesium do you like best? Of course, we think about glycinate as being very calming, but then magnesium threonate can also be particularly good for the nervous system. Do you have a favorite form of magnesium?
Yeah, I think, I've used glycinate for 100 years and it's worked before threonate came out. And so I think magnesium glycinate works as well. There's been a handful of patients where threonate was better. I think some of it is marketing hype, but I would always start with glycinate and then move to something like threonate if there wasn't the effect that I wanted.
How do you dose that?
I think many people underdose it. Magnesium glycinate, usually the capsules are 120 milligrams, and oftentimes it might be 400 to 500 milligrams a day. We start off with just 2 a day, 240 milligrams. It's short acting. It's better if you take it twice a day. And the side effect is loose stools. So if you doesn't mean you have adequate magnesium, but if you do have loose stools, I usually try to change the form of magnesium or adjust the timing of the dose.
And you've also written about vitamin B3, also known as niacin, Dr. Greenblatt. How does that help with anxiety?
Yeah, I think, B3, again, were one of those papers I did in college. So let's think, I think we're talking about the 70s. So it was a while ago. So B3 and schizophrenia was some early research that was done in Canada. And B3 actually works on the benzodiazepine receptors in the brain. And so it can be very calming. The rage now about NAD and infusions of NAD, that is a molecule made from B3.
Mm-hmm.
So vitamin B3 is a precursor to NAD. It's essential for energy in every cell or mitochondria in the body. And for some reason, this early research of Dr. Hoffer's that I followed, that there are some individuals that have a higher need for vitamin B3. And usually those individuals might have stress, trauma, or addiction. And so the typical dose that you might need for, to meet your minimal requirements wouldn't be enough. And for anxiety, I typically would use niacinamide, not niacin, because niacin could cause a flush, uncomfortable flush. So niacinamide is another form of B3. Using that at 1 to 3 grams a day can be very helpful. We use it to help people get off medications, benzodiazepines and antidepressants, but also for anxiety.
And there's also a lot of talk about omega-3s and their impact on brain health. Can you break down how omega-3s can reduce neuroinflammation and improve psychiatric outcomes?
Sure. I mean, the research on omega-3s and health is endless, and it goes back many, many years. And it just, should be incorporated into every training program for physicians to understand it. I think that we know omega-3s are critically important for brain function. The brain is 60% fat, right? So not only do we need saturated fat, but we need the omega-3s. Every aspect of that neurotransmission in the brain is dependent on adequate amounts of omega-3. And, the mechanisms we're probably not as clear about, but we have hundreds of studies looking at things like low omega-3 levels, higher risk of depression and suicide, anxiety, even psychosis. So studies looking at blood levels of omega-3s and studies looking at dietary intake of omega-3s.
I can imagine that's a big one in terms of nutritional deficiency in the US, just from all the omega-6s that we're eating. Is it more about the ratio between omega-3s and omega-6s too? Do you usually recommend people kind of watching what kind of fats they're eating overall?
Yeah, absolutely. I mean, I think the processed omega-6s, the seed oils are likely harmful, but they certainly do set up an imbalance and lower the omega-3s. And then, people might be eating less fish and sources of omega-3s. So I think it's a combination. And the other part, I think the most important part of my practice that I would say as a functional psychiatrist is everyone's different. And it's just truly amazing to me, two individuals that might eat the same amount of fish if we do blood tests, patient number one might have very low levels, and patient number two might have normal levels, and they're having the same dietary intake. So our genetics have profound influences on our ability to absorb, metabolize, and utilize nutrients.
And how do you source a high quality omega-3 supplement? Like, that's a big question.
Yeah, I sort of do it in the opposite way. Typically say I would not buy it from a supermarket or a drugstore, if you don't know the brand of the company. So there are a few high quality companies that we know that they're going to, look for heavy metals and toxins and mercury in particular, because a rancid fish oil pill is probably going to be worse than not taking anything.
I'm curious also, Dr. Greenblatt, before we move on from fish oil and omega-3s, because it is such a interesting topic and everybody's jumping on fish oils right now. But for anxiety in particular, are you looking for a certain ratio between DHA and EPA? Are you primarily focusing on EPA for inflammation? I think more DHA for cognitive decline. What are your thoughts there on balancing out DHA and EPA?
Well, the problem with being, in the field for a long time, I would read studies over the years, and every study contradicted every other study, right? And every
Yes.
supplement company had their own ratio. And these are brilliant people. And how can 6 brilliant people disagree with what we should do? So I think that the general, as argument that you described makes sense to me for EPA, higher EPA for more inflammation, higher DHA for more cognitive decline issues for the elderly. But for mental health patients, I'm just recommending a combination of EPA and DHA. I don't think there's an exact ratio, but I look for higher EPA to DHA. So maybe a 60-40% seems to make the most sense. But our body has this ability to figure out what to do. I can share with you the early studies in depression in the late 1990s here in Boston. They used 9 grams of a high dose EPA.
Wow.
And it helped. It helped bipolar patients at the time. But I saw many of those patients a couple of years later, and we looked at fatty acid levels and a tremendous imbalance in the other omega-3s and the omega-6s, the essential omega-6s. So I don't recommend high dose of just EPA and DHA. I'm pretty modest dosing, under 3 grams of EPA and DHA combined.
That's helpful. And also, before we jump into testing and functional medicine testing, what about ashwagandha? I mentioned it briefly, and I was a little surprised to see that in one of your articles, because I don't think of it as a nutrient per se. I think about it as a botanical medicine, and I was pleasantly surprised to see a psychiatrist as yourself, a traditionally trained medical doctor, speak to an herbal medicine. And so how do you use ashwagandha for anxiety? And is there something behind the adaptogenic quality that we talk about for ashwagandha?
Sure. I mean, I'll leave the kind of herbal therapies at our program. We have a few great naturopaths who talk about different herbs. But the two that I've used in my practice for many years and that we try to teach because they're simple for my medical colleagues to grasp, and the effects are pretty dramatic, would be rhodiola. So rhodiola we use for ADHD and depression, and the ashwagandha for anxiety. And they're simple, they're safe. I can use words like research and double-blind placebo-controlled trial because we have research on both sleep and anxiety. And it might not be the greatest research on the planet, but it's enough for my colleagues to grasp it and kind of modulating cortisol. It doesn't work on every anxious patient, but, a 2 to 4 week trial for some can be dramatic. And it's certainly better and safer than some of the anti-anxiety medications that we, as a psychiatrist, would typically run to.
And I just want to throw out there for listeners, when I was trained in naturopathic medical school, I had a herbal medicine professor who referred to rhodiola as the rose-colored glasses of the herbal medicine world. And I'm very visual myself, so that always stuck with me. And I thought that was a beautiful way of thinking about rhodiola for depression. And you just confirmed that's the way you use it. So it's nice to hear.
Absolutely.
Yes. All right. So let's talk about What types of tests are you using, Dr. Greenblatt, to identify root causes of mental health issues? Are you gravitating more towards toxins or stool testing to look at microbiome, blood sugar imbalance? What are you running right now as far as testing?
Yeah, it's complicating as you guys know, as we have more and more tests. And so our clinicians are overwhelmed with choices, which means our patients are overwhelmed with choices. And if you go to 10 functional medicine doctors for the same symptom, I'm gonna do the organic acid. This one does the stool test. This one does the genetic test. And I think it's stressful. I think there's a
Yes.
wide range of tests that can be helpful. I think there's a core group of tests that I would recommend for someone struggling with a mental health challenge. And that core group is not the end, but it's a place to start. And a lot of these would be routine labs like iron, vitamin D, B12, thyroid. And then I look at amino acid levels because dietary intake doesn't always predict what is being digested and absorbed. I look at fatty acid levels. I look at cryptopyrrole for kids and some adults, but certainly for all kids and adolescents. I look at food allergy testing, and I look at hair testing to look at heavy metals and particularly copper and zinc.
Any new biomarkers coming out on the market that you're excited about, or any genetic testing that you're
I do genetic tests
particularly excited
on
about?
everybody. I mean, I think it's core. I think as a psychiatrist, there are tests that look at what medicines could work better. But even some of our kind of nutritional markers, I really think as a psychiatrist, I know I get carried away when I say it, but I think not having an MTHFR test for a psychiatric patient is malpractice because
Mm.
the the results can be dramatic. I mean, it can change the course of an illness or it can augment the effects of a medication. It might not be significant, but if you don't test, how do you know? So that's partly our model. Testing is the backbone of a functional psychiatry practice. And I just really discourage throwing supplements at patients the way we've thrown medications at patients because they just don't work. Now we might gas pretty well, and we can try magnesium and ashwagandha, but to really take someone who's struggled with a mental health challenge and depression or anxiety, we can't just guess. So the more testing that we can do, the better we're going to be able to develop a kind of a personalized plan to
Mm.
support that recovery.
If you have a patient that you do some toxicity, because I think you mentioned heavy metals, correct? That you're searching for toxicity levels in some patients.
Yes.
Okay, so if you have a patient that comes in, they have maybe some heavy metals that they need to detox to get better that you find back on a test. How do you go about allowing them to detox these metals safely without flaring up symptoms?
It's a great question and it's challenging. And some of the heavy metals we'd want to do really slowly because they've accumulated over time. But some of them are directly related to their psychiatric symptoms. So just an example, copper, elevated copper, common cause of irritability, anger, impulsivity, and ADHD. I would want to bring that down quickly and because nothing else is going to work if that stays high. Versus mercury is going to be a slower process. And many times we can get our patients struggling with depression and anxiety to feel better without going through a long detox with mercury initially, that becomes more of a longer term project. So I think part of the experience is picking and choosing. Many of our patients have struggled with multiple issues around their health and the food sensitivities and reactions to food and multiple nutritional deficiencies and gut health. And you can't address them all.
Mm.
And I think the clinicians that do, the patients just can't come back because you can't be compliant. If you're on 36 supplements, on a very rigid diet, and all these detox protocols. So I think the key is prioritizing.
Especially with gut, I mean, you can't really start keeling metals out of the body if you're having addressed gut health. So is there kind of like an order or a process that you have in place of taking patients through different phases of protocols that you're not trying to tackle, the whole body or everything all at once?
There's not a set protocol. I know in our field, everyone likes to say start with the gut, and that absolutely makes sense because nothing's going to work. But what our model has been is looking at all these tests. We're going to have genetic tests, we're going to have nutrient tests, we're going to have organic acids, we're going to see dysbiosis, we're going to see everything. And then to me, prioritizing is what can I do quickly to set a foundation. And that could vary based on, like a vitamin D, optimizing vitamin D will set an incredible, profound foundation to then start doing step 2 and 3. For another patient, it might be another place to start. It could be the gut. They're so having food sensitivities, leaky gut, that might be the only thing we do for 3 months because they're not absorbing the micronutrients anyways. So again, the challenge for clinicians and the frustration for patients is that it's not always cookbook and everyone's different.
This is kind of a newer emerging thing in research and in our field. What you were saying just now just kind of made me think about it. Are you seeing patients with anxiety or even other mental health conditions having issues with histamines?
Yeah, I think there's a number of paths that, whether it's officially something called, mast cell activation syndrome, or just multiple food sensitivities, or environmental illness in terms of being responsive to lots of environmental toxins. So these, and whether it's mold and et cetera. So there are a large range of environmental toxins that are triggering these immunological responses to our body that does two things. One, it depletes micronutrients. Two, the immune system starts confusing the brain and affecting mental health. So there are many, many paths to a inflammatory response. And for some, it involves histamine. For others, it doesn't.
And I have to ask Dr. Greenblatt, you mentioned MTHFR, which is always a hot topic. It really is a SNP that many of the general public is becoming more and more aware of. And there is a prescription medical food by the name of Deplin. And so I'm curious, is there anything special about this L-methylfolate that you can prescribe under the name of Deplin for depression? It's being marketed for depression, and I believe it's also being used for schizophrenia and megaloblastic anemia, which makes sense. Is there anything special about Deplin compared to your over-the-counter methylfolate?
No. I think, I was involved when Deplin first came out a long time ago. I think it's a high-dose L-methylfolate supplement, as you said, a medical food, which costs more. Yeah. I'm cautious about high-dose L-methylfolate. I've seen side effects. So I start everybody on 1 to 3 milligrams of L-methylfolate and then titrate up. For some individuals, they do respond to 7.5 or even 15 milligrams. But it also, I've seen it trigger anxiety and what's called hypomania for patients with bipolar illness. So I'm not a huge fan of the high-dose L-methylfolate. You do want L-methylfolate versus folic acid, but we always start off with the lower doses first.
You're speaking my language there. I always say start low and slow when it comes to the methyl B vitamins. So it's reassuring and validating to hear that coming from you with so much of your experience. And I want to transition now into ADHD. And one of your articles, you mentioned ADHD, it is not a behavioral problem or a discipline problem. ADHD is a medical disorder in which genetic, neurological, nutritional, and environmental factors create an imbalance in the brain. So it sounds like it's a very complex pathogenesis that we're dealing with here with ADHD. And I'd love to know, what role does diet and nutrient deficiencies and toxins play in ADHD symptoms? What can we do about it? And I'm also wondering about insulin resistance and maybe blood sugar dysregulation for these patients as well.
Okay, so that's our 6-hour intensive on ADHD.
Yes.
And my book finally focused, and
give me the cliff notes, please.
14 module course. So absolutely, so thank you for quoting that, because I hope it takes pressure off parents, for kind of blaming these kids, because we know it's this genetic vulnerability. It's a neurochemical thing about attention, focus, and impulse control. So you have to treat it biologically. Now, medicines work, but there are side effects. But looking at it through a functional medicine lens, the model that I used in the book is the plus minus plan, that there are things that we have to add, like looking for some of these deficiencies, like folate and vitamin D and magnesium in particular. I would say almost every ADHD child and adult is deficient in magnesium. I believe there's some genetic higher need for magnesium. But then there are also things that affect ADHD that we have to eliminate. And these would be like heavy metals. Copper in particular is high. Lead is also high. The gut, we mentioned the gut. There are metabolites in the gut that can affect ADHD symptoms. So we keep coming back to the same theme that 10, 12-year-olds with ADHD, the only consistent thing I could say is they're not doing these behaviors on purpose. So an overcritical punishment model doesn't work, that they would all benefit from magnesium. And then you have to dig deeper to find out what's going to be most helpful. Is it copper overload and then we're going to give zinc? Is it a gut dysbiosis and then we're going to give probiotics? Is it, there were studies that are completely ignored now about blood sugar metabolism. You mentioned insulin resistance. We know these kids don't have normal glucose tolerance curve. So is it just a diet high in sugar sweetened beverages and ultra processed foods? So personalizing that assessment, I'm convinced, and this is what I've been doing most of my career, can make a huge difference with children with ADHD. It doesn't mean we still might not use medicines down the road if they need it, but oftentimes they don't. You can minimize side effects and just really dramatically improve outcomes.
And a huge part of functional medicine and integrative medicine is prevention. So I'd love to know, do you have any thoughts on preconception nutrition for to-be moms to help prevent ADHD? And is there any research on this?
Yeah, they actually did give studies. There were less, I forget the exact numbers, but the mothers who took probiotics, there was less ADHD.
Wow.
It was pretty interesting. So, and that was fascinating. And yeah, we absolutely are aware of some studies around pregnancy, but more of the research is preventing the symptoms down the road. So things like the ultra processed food and sugar sweetened beverages, the amount of sugar sweetened beverages dramatically predicted, ADHD. So dietary changes early on, monitoring for nutritional deficiencies like vitamin D, and looking at MTHFR. I mean, why wouldn't we do these in the 10-year-olds with maybe a family history before they have symptoms?
Mm-hmm. Those are great points.
And kind of staying on the same topic, what are your thoughts on heavy social media use and screen time? Now we're seeing phones and media usage and screens in front of, toddlers. They're running around with iPads, in their hands at the dinner table. So what's your thoughts there on how, screen time has just taken over our lives?
I do have strong opinions on the infants at the restaurant when the parents are just enjoying their meal and this really young, 6-month-old is just staring at a screen. So that does concern me. But I'm not on the side where, some of the new books coming out that screens are causing all the ills of mankind with our children, because we've had these disorders. I've been treating ADHD before we had screens. And so I don't think it's the cause, the term that I've used a lot, it's kind of the gasoline on the fire. It certainly exacerbates the stress around parenting and rules around screens and video time. And it certainly minimizes our ability to pay attention when you're so hyperstimulated. So it has a role, and we need to address it as parents, as educators, and as a culture, but it doesn't directly cause ADHD. It can exacerbate the symptoms. So typical thing that I did when I had busy ADHD practice, it was mostly the video games. The kids couldn't stop. They played all day. They got in serious rages if the parents set limits. But when we treated them, whatever it was, magnesium or zinc, and we treated them, they were able to, you have an hour with the video game, and then at 9 you have to stop, and they were able to stop. So it's not the video game, it's 8 hours of the video game. And those are the things that are challenging for some of our kids because either of anxiety, depression, or ADHD. So if we treat the underlying disorder, it is much easier to set rules and boundaries. And I'm certainly glad that the school systems are waking up to, not having phones in schools.
That's how it was when I was growing up, and I can only imagine what it's like now. I'm like, are those rules still in place? I feel like we're so attached to our phones nowadays, but kind of going off of what you said, it sounds like it's more so important just on the management side of ADHD opposed to it really being a root cause for the disorder.
It's been my experience. Yeah. I mean, if we're talking
Mm.
about the ADHD, we understand there's family history. There's usually one parent, if not both. So it just didn't come from the screen time, but the unlimited screen time, the unregulated screen time certainly is having a significant problems both for anxiety, ADHD, and depression with our children.
I do have to ask too, just because you have so much experience in this field for some time now, are you seeing rates of ADHD diagnosis increase? Because I feel like nowadays it's like ADHD medications are prescribed to a lot of the population. It's almost like a common term. I feel like everyone and their parents has ADHD now. Like it was just talked about a lot when I was in school growing up. So do you feel like the diagnosis rates have increased significantly?
It's hard to answer it. I think it's certainly overdiagnosed and stimulants are overprescribed,
Mm.
absolutely, to young adults and adults who say they can't pay attention or their kid had a positive response. I mean, there's also circles of kids I've seen that where it's been underdiagnosed. I mean, they struggled and suffered for 20 years and seeing me at age 20 and they should have been diagnosed, when they were 12. So I've seen both sides, but it's certainly the good news is now people are talking about it, all mental health issues. So that is nice to hear. I do think that the stimulants are these are amphetamine drugs, which will help anybody focus and pay attention. So there is just a path to misuse because people say, well, I feel better on it, but everyone would feel better. I mean, that's our morning coffee and maybe our afternoon coffee. But so feeling better on an amphetamine doesn't mean you have ADHD.
I think that's a good point. And I think also too, just speaking to the overdiagnosis, it's do all these people really have ADHD or are we just not designed to sit in school for 8 hours straight? Are we not designed to stay up all night studying for exams in college? Are we just not designed for that? Or maybe not everyone's designed for that? Or do we really have, true disorders going on? So something I think about.
No, I think it's really important. And that, again, back to individuality. And most of us, are not designed to sit in these classrooms for long periods of time. And some can, but one of the most important treatments for ADHD is understanding what the best environment is for learning and really appreciating that for that individual.
I'd like to know, Dr. Greenblatt, you mentioned the diagnosis later on in life and maybe overdiagnosis and underdiagnosis. Does ADHD present differently in an adult patient, and how so compared to the pediatric patient?
The only difference in our pediatric patients, we often see hyperactivity, right? So the movement, the fidgeting, the rocking, the not sitting still, and that impulsive behavior. As we get older, we don't necessarily hit our friends. We're trying to get their attention.
Yeah, I was
We
going to
might
say maybe in this remote setting, but
occasionally we fake it better, but I find it become a more internal sense of restlessness.
Hmm.
But it's the same in attention. The word I like is persistence of effort. It's hard to follow through. The impulsivity might be there in other fashions, but adult ADHD is really important. And I'm just recording a course for consumers on it because untreated adult ADHD, the research has been clear. Higher rates of divorce, poor job performance, socioeconomic problems, arrests, and the most frightening one is motor vehicle accidents.
Ooh.
So really, a lot of studies, both in the lab and in the research community, that much higher rates of motor vehicle accidents. So untreated ADHD has consequences. The biggest one is, the assault on one's self-esteem, feeling like you can't finish a project or do the kind of work that your neighbors are doing at school, even though you're smarter, and that kind of not working up to your potential, can be devastating.
Any special therapies that you like to use, maybe not as so common, such as binaural beats or these kind of sound frequencies I've seen may be calming and helpful for focusing for those with ADHD, or anything else kind of novel and interesting that you're coming across?
Well, for years we did neurofeedback in the office. That was helpful for ADHD, but it was time consuming and sometimes expensive. But the one nutritional supplement that we use, I've used for 30 years for ADHD, is the OPCs. So these highly concentrated phytochemicals from grapeseed extract, blueberry extract, that we did research on that many years ago, but it kind of affected the brainwave patterns similar to. So those are some of the supplements that we use in addition to looking at the testing, so we can kind of fine tune a kind of personalized nutritional plan.
Any thoughts on saffron? I've seen a little research on saffron supplementation and ADHD.
Yeah, I think the research looks pretty good. And for depression and now for ADHD, I haven't used it as a sole treatment because most of the patients that I've seen, wouldn't be sufficient. So I think, we're looking at copper toxicity and the magnesium. So I've read some of the studies and they look okay. But I think many of the patients, you always want to look at the underlying nutritional deficiencies first.
Sure.
And then saffron might be something that might replace a medication or used before a medication to see if that provides any benefit.
Or maybe in conjunction with a medication. I wonder about that research. I haven't seen it, but I haven't looked for it.
Yeah, no, I think all of the nutritional interventions, except for some of the amino acids, can be done with medications. Absolutely.
Yeah, that's the beauty of it. And the work you're doing, it's so important and easy and approachable and accessible. So thank you for that. And we're coming up on the hour here. I'd love to know, Dr. Greenblatt, before we say goodbye, if we have practitioners listening who may feel intimidated by treating mental health disorders, or they may not be familiar with how to use functional medicine testing to monitor the nutritional deficiencies in the mental health patients that they're seeing, what advice would you give those individuals? Where can they start? I'm sure you have some training courses as you've mentioned, but where could they start learning about how to incorporate this into their practice?
Yeah, I think two thoughts. It can be both exciting and overwhelming, I think, as you're alluding to, because it's oftentimes things we didn't learn in school.
Yep.
And it takes time and energy. So in our programs, we have a year-long fellowship where we're slowly training people, but we also have these short intensives, these 4 or 5 hour programs. And I think the simplest model might be ADHD, and we have that, I think, coming up in the winter. So just jumping into one topic, the most common thing that you see in your practice, depression, anxiety, or ADHD, and just kind of understanding and learning about that, and then sifting through and learning, nutritional supplementations kind of one at a time. Magnesium being the simplest and the easiest. Take it yourself, give it to your family members, know how to take it and prescribe it to a patient as if you would a medicine. And it just makes sense. And then you can kind of work to the MTHFR variant. But I think if you do it slowly, it helps build your confidence as a clinician, and then patients will, trust you.
Overarching theme is take more magnesium. I feel like we can't go wrong there.
And one step at a time.
I don't think you can go wrong. Absolutely.
It's been something I've been dosing constantly, probably at least the last 5-10 years. It's probably something I'll never take off my supplement list. But thank you so much, Dr. Greenblatt, for all of your expertise that you shared with us today. And I just really love how you kind of integrate traditional medicine and the functional side and kind of blend them together. You use the testing, use supplementation, nutritional approaches, but you're also not afraid to use medications where it's needed. And I think there's definitely something to that. And I think our listeners are going to take a lot from this episode. And if anyone tuning in today wants to learn more of your work, they want to train with you, where can they find some of your educational materials, or where can they find you online?
Sure. I think the best website is psychiatryredefined.org. And there are plenty of materials. We do free content every month. And then there are these intensive programs and then the year-long training.
We like free.
Free.
Well, be sure to link your website down below so everyone tuning in can locate you online. Thank you again so much for taking the time today. And for everyone tuning in, thanks for listening. And until next week, wishing us all vibrant health and wellness.
Thank you.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.